Hi, I'm Joy, CEO of Advanced Animal Diagnostics. This is my friend Karen. She went in for what was supposed to be a routine knee replacement surgery, but she ended up with a bacterial infection that was resistant to antibiotics. So 4 surgeries, and more than a year later, Karen was lucky to not be a statistic. 700,000 people a year are dying of infections that are resistant to antibiotics. By 2050, that number is expected to be larger than what's killing cancer and diabetes combined today. So clearly, we need to reduce our use of antibiotics to combat antibiotic resistance. One of the largest users of antibiotics is the livestock industry. I'm a livestock producer myself, and I can tell you we desperately need better tools. We're really caught in the middle because on one side, consumers are putting pressure on us to reduce antibiotic use because of concerns about antimicrobial resistance and transmission to humans. On the other side, we're responsible for the health and well-being of the animals entrusted to our care. We're already losing about 20% of the animal protein that's produced due to death and disease with antibiotics. So clearly we can't get rid of them. We just need technology to help us understand which animals need them and which don't. That's AAD's mission. We're doing point-of-care, point-of-cow diagnostics to precisely target antibiotic use. So when high-risk cattle arrive at a feedlot, like what you see here, the producer doesn't have any technology to understand which ones need antibiotic treatment and which ones don't, so a default is to mass treat all of them with antibiotics. Instead, we developed a test where we can collect a drop of blood with this device, put it into a test that stains the white blood cells. When it goes into our lab in a box, we can understand the first responders of the immune system. What's the immune status of that animal? In 32 seconds, we can give a result that tells them whether they need to treat that animal with antibiotics or not. So we've seen that we can cut antibiotic use by up to 70%, and that means we're combating antibiotic resistance by targeting only the animals who need antibiotic treatment, and we can reduce costs for the producer by up to 44%. So would you rather have the standard of care in technology be the thermometer that it is today, or the kind of technology we're developing? If you'd like to learn more, visit us at qscoutlab.com.